Under Standing Order 36, we welcome the Minister for Finance, so we call on Deputy Pearse Doherty first, please.
Gurmaigad the Cairns TD. Agus ara seo rialtas in a bhil se cruthí a ríis agus a ríistile go gorann sibh airgid na Cairns TD ar mawa. Tá ráchaide as the billion go leithfeici gáin ó hiú hospital nation na leanaí. Tá sibh caiú €336 million ar shed na rothar. €1.4 million le hé an botha sláindale. Agus is sample is mulle de the hud cormau airgid Cairns TD na tíre seo. Tá sibh caiú 9 million ar pouchnaí da gúhain póca. Agus tá greagaí na tíre seo ceistú bhfuil a plot cailte ag an rialtas seo. Seo sample eile da rialtas na féidir linn muín a bhí antú ó hiú Cairns airgid ó hiú airgid na Cairns TD a chaithú mar is ceart. Minister, this is a government that has proven time and time again that it plays fast and loose with taxpayers' hard-earned money. We've seen an overspend of €1.5 billion in respect of the National Children's Hospital. You're spending you've spent €336,000 on the bike shed, €1.4 million on the security hut, and in the budget on Tuesday we saw the latest example of your waste of taxpayer money when you announced €9 million for phone pouches. The ordinary people of Ireland are asking, has this government lost the plot? This is just another example of a government that can't be trusted with taxpayers' money. And can I ask you, Minister, when you sat round the cabinet table and made this decision, did not one person put up their hand and ask the question that maybe we should spend this money on the 100 children with additional needs that still don't have a school place at this point in time? Did not one government minister at the table maybe say we should spend this money increasing capitation funding so that schools can actually cover their lighting, can actually cover their heating bills? Did nobody at the cabinet table put up their hands and say, why don't we just ask the kids to leave their phones in their bags? Spending €9 million on phone pouches is grotesque and it is inexcusable, particularly at a time when Fianna Fáil and Fine Gael have underfunded our schools across this state, with many schools, most of them, are struggling to pay to electricity costs and heating costs. And budgets, as you know, are all about choices. And when you choose to underfund our schools for the basics, it's the parents. It's the parents that pick up the tab. And we see this right across the state. We see it with cake sales, race nights, 5K, voluntary contributions, all to raise money to keep the lights on and to pay the bills. And if there was ever an example of political parties being in power for far too long, drifting further and further out of touch with the realities on the ground, it is the Taoiseach, where he took to social media this week championing the fact that you're spending €9 million on phone pouches. You couldn't make this up. So, Minister, just stop. Stop the waste. Unlike the bike shed, unlike the €1.4 million security hut, this money, as of yet, has not been wasted. So will you just please see sense? Will you announce to the people of Ireland that you are not going to waste €9 million on phone pouches? And will you instead put that money into schools so that we can pay for the lights, the electricity costs, the heating costs and other costs that those schools need? Gurmaigad.
Gurmaigad Cairns TD, and Minister Foley announced details of an unprecedented education budget of €11.8 billion. And part of the €9 million which has been allocated for new mobile phone pouches to support schools is to implement a policy which is about mental health, well-being and the dignity of children. And I would say to you, Deputy Doherty, you should never play politics when it comes to the mental health of young people, of children in schools across our communities. The investment in children's welfare, in mental health, in dignity at school is never a waste of money. And if this helps one young person in a school where they've had difficulties, for example, with the use of mobile phones in schools, is that not a progressive and practical initiative to help support young people, to help support their learning in schools? This policy is underpinned with clear evidence internationally. We have the UN and many European and other jurisdictions around the world demonstrating that this is a research-based initiative. It's an initiative supported by parents of children all over our country, building on the success of the Keeping Childhood Smartphone Free initiative. As Minister Foley outlined this week, schools will have the authority to decide what phone storage option they will have. And the international research on smartphones is incontrovertible and clearly demonstrates that students perform better when they take a break from a mobile phone. We're ensuring that students do have a break away from their mobile phone to help their learning, to help their well-being in schools. And I would say to you, you should not play populist, shallow, divisive politics when it comes to the mental health of young people. That's the purpose of this investment. And if you take it in the context of our wider investment in education, through this budget, we are investing €2.9 billion in special education. We're extending the provision of free school books to all students in the senior cycle, €75 million in increased capitation funding. And Minister Foley has secured that, but she's also cognizant of the concerns of parents right across the country when it comes to the use of smartphones in schools. And this is a practical measure to give effect to the policy which has been introduced in jurisdictions right across the world. And it's a great pity that Sinn Féin won't take the time to study this initiative before you go to your stock position, which is to attack everything. Anger and attack is your policy, not constructive politics dealing and trying to give a practical outworking of a solution when it comes to the use of mobile phones in schools. Have you listened to the parents whose children have been impacted by the enormous damage caused by smartphone use during the day? And this will make an impact. It will make a difference. And we should never play politics when it comes to the investment in our young people, in initiatives that will help their mental health, their well-being. And that's what's at the centre of this initiative in what Minister Foley has sought to do.
You for real? Yeah. Seriously, talk to any parent out there who's got a child with mental health difficulties and show me one of them that says that their priority, instead of getting somebody that will help them, that their priority is getting a magnetic phone pouch that's going to cost the state €9 million. Your government has underfunded mental health for years. So don't try and wrap this vanity project up as some way of supporting hard-pressed parents who know that their children are being let down over and over again. Minister, if you want to ban mobile phones, tell the kids to leave them in their pockets. Don't be spending €9 million on pouches. It makes no sense at a time when schools are struggling, when mental health is struggling. And you dress this up as something that it is not. Do you seriously think that any child who is self-harming at this point in time and who can't get the support through the mental health services, where they are underfunded right across the state, that the priority for those parents is a phone pouch? You're living in cloud cuckoo land if you genuinely believe this. So I say to you now, just like the bike shed, just like the security hub, stop the waste. Fund proper services. Put the €9 million, if you want, into the services that parents are demanding, screaming out for in mental health. Therapists, people who can see them, instead of waiting not only for months, but in some cases for years to see a practitioner.
It's again your populist politics driven by anger, a shallow attack on an initiative that will make a difference. And this is part of a wider well-being and mental health policy in schools. And if you looked at all the international research from the UN and others, this makes a difference when it's being introduced. Smartphone bans in schools has an impact on young people's mental health. And just as I've said previously, an investment in children's welfare, in mental health and in well-being in schools is not a waste of money. And Minister Butler, who's beside me here, has secured record funding over the last 5 years, a 43% increase in mental health funding for our mental health services right across the country. And we are supporting the improved recruitment within our mental health services in community health organisations right across our country. So complementing this initiative is an unprecedented investment in our health system, in support the growth of our mental health services. But you should not go back to your stock position of attacking initiatives which will make a difference.
I will attack every single day.
You're a party that looks to spend day in, day out in all the budgetary positions you've outlined in your pre-budget submission. It's a party policy defined by more spending on everything. In fact, that's your pre-budget submission.
Not waste, not the bike shed, not the phone pouches.
And this is a policy to protect children, to protect their mental health and well-being in schools. And you should not. It's disappointing to see you attack an initiative that will make a difference.
Minister, recently your party leader, the Taoiseach, claimed that the Social Democrats believe that Ireland is a failed state. It seems like he was literally just making stuff up and saying it on national radio. I've always acknowledged the country's many positives and successes, and I've consistently pointed out the profound sense of disconnect that many people have as a result of that. A disconnect between a GDP that makes us one of the richest countries in the world and nearly 4,500 children growing up in emergency accommodation. A disconnect between full employment and 500,000 adults living in their childhood bedrooms. A disconnect between a €24 billion surplus and nearly 600,000 people living in poverty. So no, we're not a failed state, but the government is failing far too many people. And that failure is not inevitable. It's not an accident either. It's a product of political choices that have been made at cabinet tables in this government and in previous governments. Political choices about what to spend money on and how much. Political choices that led to a 15% increase in the number of children experiencing deprivation last year alone. Political choices that led to disability services becoming threadbare and dysfunctional. Political choices that resulted in a failure to meet social and affordable housing targets every single year. Political choices that have set us up to fail when it comes to meeting our climate targets. This week's budget was also full of choices about what to prioritise and what issues were deemed not so important. Listening to you there for the last few minutes trying to defend the €9 million that was allocated to the school phone pouches. This was done because, fair enough, the Minister wants schools to ban phones, but she doesn't have the power to do that. So we can all agree on the need to prioritise mental health and children's mental health, but to prioritise phone pouches with regard to that doesn't make a whole lot of sense to most people. €9 million on a pet project that schools weren't crying out for. It's a lot of money and it could have done some real good. That €9 million could have been used to invest in special schools. There isn't a single special school, for example, in my own constituency in Cork South West. It could have been used to fund therapists in St Killian's Special School in Mayfield who were promised supports from Minister Rabbitte that never materialised. There have been no occupational therapists, speech and language therapists or behavioural therapists in that special school or any other since 2020 when you entered government. The Taoiseach said he disagreed with the decision that resulted in the therapists being removed from schools. Well, a Fianna Fáil minister holds that brief. A Fianna Fáil TD is the Disability Minister and you are the Finance Minister. What has been done about it? Nothing as far as I can see, while children with additional needs are repeatedly failed not by anonymous systems but by political choices. Minister, do you even at the very least accept that your government has failed these children with additional needs?
Thanks very much, Deputy, and acknowledge the difficulties that many families face when it comes to access to therapies, supports and assessments of needs in communities across our country, and that's something I see in my own constituency office, and I know all of us collectively share the priority in trying to advance progress when it comes to people with additional needs and disabilities. From an education perspective, you referenced Minister Foley and what she has sought to advance in Budget 2025. And there's an unprecedented €11.8 billion of investment in education and schools in Budget 2025. And the education budget contains €2.9 billion of funding for special education, which will make a difference for those with additional needs and support the provision of additional places and progress for many families and children. The provision of free school books to all students in the senior cycle makes a difference when it comes to the affordability of education across our school system. €75 million increase in capitation funding, which supports schools and communities across our country who need improved core budgets. over €100 million in additional funding for the school transport system, for example, and 1,600 more SNAs and 750 additional special education teachers. That makes a difference for pupils and students with additional needs, particularly in the special education area. And that's why we have sought to advance that in the context of Budget 2025. You referenced the investment when it comes to the mobile phone pouches. And as I've said to Deputy Doherty, this is about investing in wider in the support of mental health and well-being policy in schools. We have to give a practical outworking to this initiative, which parents have reflected concerns about this at second level for many years, and this enables schools by supporting them to actually implement such a policy. When it comes to the area of disabilities, Minister Rabbitte has been steadfast in securing a much greater disability budget, and if you look at the investment in disability since 2019, it's increased by 52%, and there's a clear commitment of this government to help support those with disabilities and their families. Not only are we speaking about the UN Convention of the Rights of People with Disabilities, but we're ensuring that the increase in spending is delivering real improvement in the lives of children with additional needs. And this year there's a record €3.2 billion of funding specifically in the disability area, and there's a focus on obviously assessments of need, therapies, and ensuring that we recruit the frontline staff who do make a difference. And I recognise that the wait times for many children with disabilities are too long in communities across our country, that they're not getting the level of intervention that they require. But the investment and the prioritisation for Minister Rabbitte will increase the number of frontline workers in the Children's Development Network teams, for example, and that will help through the budget that we've allocated.
The Taoiseach told disabled people that they would feel seen by this budget, and in your reply there you just said that we all share the feeling that it needs to be prioritised. I would ask you, Minister, if you genuinely think the children who are waiting and their families to access Children's Disability Network teams, do you think they feel prioritised or seen from this budget? Do you think that people who were hoping the motorised transport grant for disabled people that was axed over a decade ago might be reintroduced in this budget, do you think that they might feel seen? Do you think disabled people who are unemployed, disabled people in Ireland, that we have the lowest employment rates for disabled people in all of Europe, do you think those people feel seen in this budget? Was anything done for them? Do you think that disabled people who will get the one-off payment feel seen when you have a disability for 365 days of the year? Do you think that's an attempt from this government to prioritise disabled people or make them feel seen? Last year, when we got the budget announcement, first of all, we heard from Anne Rabbitte that there was an allocation of 195.1 million. Then the Minister for Finance at the time, Michael McGrath, said that it was 200 million. And then after Alva Keneally, the journalist, examined it a little bit more closely and got answers from the department, it turned out that it was actually only additional 64 million. So can you give me an exact figure of how much of the figure that you've highlighted there is actually additional funding this year, or will we have to leave it up to journalists to establish the reality of the allocation for disability this year?
Thanks, Deputy. And as I've said in my previous answer, this year's budget is a record of €3.2 billion, which is an increase of 11.6% on 2024. And that's been set out to me from the department involved. And what that will result in is further progress on a lot of the initiatives that have been established by Minister Rabbitte. So, for example, the waiting list initiative in the first half of this year, there's been improvement in the number of assessments of needs completed, which is a 28% increase on the same period of last year. Regional hubs have been established across the country and are operational. And there's strong oversight from Minister Rabbitte to ensure that there's delivery and much greater progress in terms of oversight with all of the various CHO teams right across the country. And through this budget, there will be further progress for people with disabilities this year and next year. We have a substantial cost of living package complemented with core social protection allocations from Minister Humphreys, which are very specifically focused on people with disabilities, their carers and their families. And this government wants to do more, particularly to support improvement in frontline interventions for those who have been waiting too long.
Today I would like to raise with you the urgent need for an elective surgery hub at Midlands General Hospital in Tullamore. This is an issue that I have been raising locally since March, and indeed I also sought a direct meeting with Minister Donnelly at the time, following a letter I received from a senior member of the medical team at the hospital, which highlighted the whole issue around this particular case. At the time, Tullamore was inundated with trauma patients, leading to a situation where the facility had zero capacity to offer any elective surgery for knee or hip replacement procedures. It had no access to an elective ward because it had to accommodate and facilitate emergencies that were pouring in through the A&E department. This is entirely unacceptable, as the volume of patients being seen here at Midland Regional Hospital have increased 40% year on year, which by any objective analysis is a huge volume for a Model 3 hospital. The core of the problem resides in the fact that there has been no meaningful rollout or increase of elective surgery capacity within Tullamore or indeed the Midlands for the last decade. While the staff at the regional hospital are working heroically to meet the level of demand, and I want to commend them for all that they're doing, it is unfortunately clear that they now have hit a wall, and that unless there is improved capacity put into the system, things are only going to get worse for local patients who will continue to be sent to other counties to access basic services through the National Treatment Purchase Fund. I am also aware that Midlands Regional Hospital has seen a 29% increase on attendees of people over 75 years, compared to the same period last year. Again, as a result of this, its emergency department has been under significant and ongoing pressure. Scheduled care activity has also been impacted as a result of this increased demand. Minister, what we have here is a major problem with a very clear and simple solution, and that solution would be to provide a commitment to the people of Tullamore and to the Midlands Regional Hospital Tullamore for a dedicated elective surgery hub to the benefit of all in the Midlands region. Without this solution, the knock-on impact to service provision and delayed care will continue to get only worse over time. Government has just announced one of the largest ever budgets for the health service. I am specifically asking here today what fraction of that allocation is going to be directed to Tullamore Hospital, and will consideration be given for an elective surgery hub? Garv Margaret.
Hospital. I just want to say in the first instance, Minister Donnelly with Minister Butler and others have secured record levels of investment in our health system, which is making a difference for patients, families and communities across our country. Over 25 billion euro being spent in 2025, and the recent budget will see a further 180 million euro in new measures, including support for cancer care, cardiovascular and stroke care, as well as rare diseases. And the impact of this investment in healthcare from the government is seen through the very significant achievements that Ireland has made in the last decade when it comes to health outcomes. We're amongst one of the small group of only 7 EU countries where life expectancy is above 82, and we're seeing the impact of that across a number of metrics. But we know we have to do more, and that's why Minister Donnelly has set out a very ambitious capital plan, particularly to address the demand when it comes to surgery and an elective plan within that. And that's why he has set out the development of 4 elective hospitals, 2 sites in Dublin, in Connolly, and the Children's Hospital in Crumlin, 1 in Cork and 1 in Galway. And there are also surgical hubs that are being delivered in Cork, Dublin, Galway, Limerick and Waterford. And that complements the wider focus of this government when it comes to our primary care system, where a lot of patients who would have otherwise presented to A&E are being triaged through community health care and being supported through the community health service when it comes to chronic disease management and a whole other range of areas. We've also increased bed capacity with an additional, we've constructed over 1,000 new and replacement community-based beds across our country, and Budget 2025 has provided funding for 160 new community beds and 455 upgraded community beds. And the funding for this for the future is that by 2031, there's a plan for an additional 3,000 new hospital beds and 350 replacement beds. So this government is providing unprecedented resources supporting the recruitment of frontline workers in healthcare when it comes to doctors, nurses and allied health professionals, but also addressing the capital needs in our health system with a changing demographic. And Minister Donnelly is advancing that through acute hospitals, some of which is in the Midlands region around the wider provision of new beds within the hospital groups. When it comes to your specific question on the elective hospital for the Midlands Regional Hospital, Minister Donnelly will be able to provide further detail on further plans on that. I have set out the briefing I've received on the various surgical hubs and also the elective capacity which is planned, which has a good regional spread. And it's important that patients in the Midlands and elsewhere have access to improved elective care, and that I think the future of overall capital investment will be to ensure that we have greater number of elective beds within our overall hospital system in Ireland, so that the acute hospital system can manage the presentations which occur on a day-to-day basis, and that will allow greater certainty for patients that are waiting for elective care on an ongoing basis.
Deputy Nolan.
I thank you for your reply, Minister, and I know you mentioned record levels of investment, but we need to see more investment in Midlands Regional Hospital Tullamore. And it is disappointing that Minister Donnelly didn't respond to my request to work constructively with him and to have a meeting with him on this issue. I feel that it's a very, very serious issue. Health is important, and when elderly patients cannot access care at their own local hospital, we know there's a problem. When senior medical members of a team are coming to their TD flagging that there's a problem, then there is a problem, because it's not just me saying there's a problem, the medical staff are saying it, and indeed elderly patients who can't access local care are telling me that there's an issue, that they have to go to other counties for elective surgery. That's wrong. That's very wrong. And I would hope that Minister Donnelly will come back constructively and give me the opportunity to meet him about this issue, because I have sought that. And I hope that that will happen, because certainly this is an issue that cannot be ignored. Again, I want to commend the excellent staff at every level in Midlands Regional Hospital who have worked tirelessly to help patients and indeed to reduce the waiting lists. And the waiting list was again reduced last year for the second year in a row. I commend them for that. But that was partially because patients were forced to go to other counties for care, partially because of that. And I would hope that that situation will change and that government will show more political will and indeed be constructive in listening to other TDs who are only trying to do their best and do the right thing by the electorate as well.
Minister.
Thanks very much, Deputy Nolan, and I want to agree with you on the huge amount of work that frontline staff do across our hospital system, and I commend them in the work that they do in difficult circumstances on an ongoing basis. But I would say is the government's investment in healthcare is achieving outcomes, and there's faster access to services, with the numbers on trolleys over the first 8 months of the year down 11%, for example, and that demonstrates the commitment and the ongoing progress we're seeing in our health system. There's been enormous progress in Tullamore and indeed the Midlands group when it comes to numbers of patients on trolleys, for example, which is demonstrates the investment and the impact that the unprecedented resources and the recruitment of frontline staff is having. Similarly, I know there's further staff plans for recruitment within the Midlands Regional Group and Tullamore for next year, and that again builds on the progress that we've made when you look at the trolley count in Tullamore, for example. We're really seeing an impact when it comes to wait times, but we have more to do, and that's why with the budget we've secured next year, Minister Donnelly is keen to complement that investment in frontline health workers with capital investment for the future, and thousands of more beds being developed right across the country for the coming years.
Deputy Joan Collins, please.
I've been dealing with the case of Marianne Bourne, a worker at the Cove Heritage Centre in Cork. This is a low-paid worker who was given 26 years of dedicated service, who was offered a 50 cent per hour increase by her employer after 16 years without a pay increase. Colleagues in a similar position were given raises of €1.50 an hour. Cove Heritage Centre justified this paltry offer by saying Marianne had received a €2 pay increase 15 years ago. 15 years ago. You can't make this up. Marianne was represented by Unite the Union in the WRC and won a recommendation for an 85-cent raise to match the living wage. The Board of Management for Cove Heritage Centre, which relies on public finance and support, has been refusing to implement the recommendation since May the 8th of this year. It is a blatant and disrespectful and disregard by the board of the Cove Heritage Centre. They didn't even plead an inability to pay at the case and engaged HR Suite, a private company, to represent them at the WRC. This simply isn't good enough, Minister. Marianne's Unite representative, Owen Drummy, has written to Minister Catherine Martin and the Taoiseach on Marianne's behalf, stating this refusal not only perpetuates the mistreatment of long-standing female employee on low pay, but also undermines the authority of the WRC and the principles of fair and just employment practices that it upholds. It is unacceptable that a state-supported entity should fail to rectify a situation that has caused significant hardship for Miss Byrne over several years. There has been no reply or even acknowledgement from either the Minister or the Taoiseach. It cannot be acceptable for a service which relies on state funding to undermine the WRC and refuse to pass on an 85-cent pay rise recommendation for a long-standing worker. I have on other occasions raised other representations being made by Unite and other unions for low-paid workers, particularly in relation to workers in voluntary and state-funded organisations. Ireland has one of the highest instances of low pay in the EU. Not enough has been done for these workers. The very least you can do as a government is to ensure that state-funded organisations are passing on WRC adjudications. Cove Heritage Centre relies on state funding. They're refusing to pass on a WRC recommendation, justifying this by a pay increase 15 years ago and ultimately failing to pay their workers a living wage. What can you do as a government to step in here? You can, Minister, make sure that Marianne gets the pay rise she deserves and make sure that WRC is not being undermined by an organisation funded and supported by the state.
Thanks very much, Deputy Collins. And just to say, I can't comment on a specific WRC case or something that's subject to legal proceedings. And I acknowledge that, as you've said, it's been through the WRC and there's been interaction between the worker and Cove Heritage Service, as you've said. What I would say is that the government is committed to supporting low-pay workers in our economy, and that's why the national minimum wage will increase to €13.50 per hour from the 1st of January 2025, and an estimated 195,300 workers will directly benefit from this increase. And the government accepted the recommendation from the Low Pay Commission because of that, and that demonstrates our wider commitment to progress a living wage in our economy. It's also important to acknowledge the wider footprint that we've brought through when it comes to workers' rights, not only on the national living wage, but also the introduction of a statutory sick pay entitlement for all workers in January 2023, which is making a difference to workers in our economy. I'm conscious, though, that the questions you've raised are specific to a specific worker, and I obviously here in the Dáil can't comment on any individual case, and I have to be careful what I say in response to it. I will reflect on what you've said to the respective ministers who have received correspondence on that, and they'll have to judge what's appropriate in any response, given it's been through and there's ongoing legal proceedings.
Thanks, Minister. I'm not really happy with that response. You're saying a specific WRC case. The case has been adjudicated on. They have been told to pay Marianne 85 cent extra, €14.85 per hour. That's gone through, that's done. What I'm raising is that you have a public body not implementing the WRC adjudication. And if you have public bodies not doing it, you certainly see private bodies and private companies saying they're not going to recognise any WRC recommendation. It's an absolute scandal. And what I'm asking you as a government to intervene in is to ensure that public bodies implement WRC adjudications to cases in the WRC, because the fact is the state provides the Workplace Relations Commission as a statutory body to assist resolving workplace disputes and complaints, and this service is fully funded by the public through the Exchequer, and its decisions should be implemented promptly by all employers, particularly those receiving public funding. So I want a commitment that you will step in here and ensure that the Cove Heritage Centre as a public body implements that pay increase that WRC recommended.
Thanks, Deputy. And what I would say is, obviously, I'm not familiar with the specifics of the case or the particular structure of that company or how it's funded through the respective department. So I will reflect what you've said to the line ministers who may provide funding to that particular entity, and obviously they'll have to judge what's appropriate in the context of what the service level agreement might be. But it is important in our economy that we protect workers, and obviously the WRC plays an important role in that context. So I will reflect what you said. Obviously, I'm not aware of what the status or of the relationship is between the department and that particular company, or what the corporate status of it is. But if there is a service level agreement, the department will be able to reflect on what you've said and maybe the correspondence they've received, and I'll reflect what you've said today to them.
That their increases, but they won't implement a WRC adjudication. That
concludes leaders' questions.